Hi, I'm Dr. David Goldblum. I'm a psychiatrist and I'm here at CAMH, also known as the Centre for Addiction and Mental Health, which is Canada's largest mental health and substance use teaching hospital. In this series, we're exploring the top mental health questions on the internet, so make sure to subscribe to our channel and turn on the notification bell to stay informed. We all eat too much on occasion. People with binge eating disorder, however, have recurring episodes, at least weekly, of significant overeating in a short period of time, often just a few hours. They feel they can't control themselves or their eating choices. People with binge eating disorder don't compensate for their overeating by making themselves vomit or by limiting what they eat. People usually feel shame or disgust during and after each episode. This shame can take an internal or external focus. For some, their shame is tied up with trying to conceal their binges. For others, it can intensify feelings of depression and self-loathing. These negative emotions are central to binge eating disorder. Binge eating disorder appears to result from many things, including biological factors, childhood trauma, food insecurity, a history of dieting, challenges with emotional control, family relationship stressors, and other social factors. Women are more likely than men to develop binge eating disorder, and it often develops in the late teenage years or in early adulthood. When people have binge eating disorder, they eat large amounts of food in a single episode, feel they can't control their binge eating, experience feelings of guilt, disgust, or shame after each episode. People with binge eating disorder don't tend to fast, make themselves vomit, or exercise excessively to compensate for their binge eating. These symptoms are what distinguishes binge eating disorder from other eating disorders, such as bulimia nervosa and anorexia nervosa. Although people with any body weight can develop binge eating disorder, the rates of binge eating disorder increase with higher body mass index. Therefore, it's important for people living with obesity to be assessed for binge eating disorder, as it can complicate obesity treatment and weight management. Obesity brings its own considerations, including a higher risk for medical conditions such as diabetes, hypertension, certain cancers, and heart disease. In short, someone living with binge eating disorder is more likely to develop obesity, which brings health risks. People who binge eat tend to experience other mental health concerns alongside their disordered eating, including anxiety disorders and depression. Research has also shown a higher incidence of self-reported problematic use of alcohol and drugs. And lastly, studies have found that people who binge eat often have negative body image and a preoccupation with their weight. Low self-esteem and challenging family relationships can also be problems in this group of people. The treatment of binge eating disorder has sparked a debate among experts in the fields of obesity and eating disorders. Some argue that addressing the psychological issues that increase vulnerability for binge eating is essential, focusing on psychotherapies like cognitive behavioral therapy and interpersonal therapy. These treatments help to improve binge eating and treat underlying emotional struggles, ultimately leading to positive outcomes for the patients. People living with obesity and more severe eating disorder may require specialized treatments, including medications. Medication like lisdexamfetamine is often a first-line treatment for moderate to severe binge eating disorder. Combined Approaches involving behavioral weight loss and psychological therapies may lead to more effective treatment of both binge eating disorder and obesity. Binge eating disorder can be difficult to recognize and hard to understand, but with the right support, people can recover. I'm Dr. David Goldblum. Thanks for watching. Did you like this video? Subscribe to our channel for more evidence-based insights on mental health and substance use.